Inpatient versus outpatient stroke rehab, which one for me? Imagine waking up after a stroke and wondering what kind of help you'll need to get back to your life. Choosing between inpatient and outpatient stroke rehabilitation can feel overwhelming, but understanding the differences can help you make the best choice for your recovery. Both options are vital parts of stroke care, but they serve different needs depending on how severe your stroke was and what your recovery goals are. Inpatient stroke rehabilitation happens in a specialized hospital or rehab center. Patients stay there usually for about 2 to 3 weeks. During this time, they receive intensive therapy from a team of specialists including physical therapists, occupational therapists, speech-language pathologists, nurses, and neuropsychologists. The goal is to help regain mobility, independence, and daily skills as quickly as possible. Patients often get therapy for at least 3 hours a day, focusing on improving strength, coordination, speech, and cognitive functions. This setting is ideal if your stroke caused significant physical or mental impairments, or if you need close medical supervision because of other health issues. Being in a rehab facility also means you can focus solely on recovery without the distractions of home life, which can speed up progress. Outpatient stroke rehab is usually for people who have already completed inpatient therapy or who had a milder stroke. After leaving the hospital, patients attend therapy sessions several times a week at a clinic or sometimes through home visits. Outpatient rehab offers more flexibility, allowing patients to live at home and continue with daily routines while working on their recovery. Studies show that outpatient therapy can be just as effective as inpatient care, especially if started early and combined with ongoing support. This approach helps maintain gains made during inpatient rehab and encourages continued progress over time. When deciding between inpatient and outpatient rehab, several factors come into play. The severity of your stroke is key. More serious strokes often need the intensive support of inpatient care. Your overall health and any other medical conditions also matter, as some patients requiring close monitoring that only inpatient settings can provide. Support at home is another big factor. If you have family or friends who can help you, outpatient rehab might be a good fit. If you lack support or need more medical oversight, inpatient care might be safer. Your personal goals, motivation, transportation options, and insurance coverage also influence the decision. Most importantly, both types of rehab are part of a continuous process. Many patients start with inpatient therapy to build a foundation and then transition to outpatient or home-based programs to keep improving. The best approach is tailored to each person's unique situation. Healthcare professionals will evaluate your medical status, recovery needs, and social circumstances to recommend the most suitable plan. Remember, stroke recovery is a journey that can take months or even years, and combining different rehab options often yields the best results. Always consult your medical team to develop a plan that supports your long-term health and independence.